Let's cross to regional Victoria now and catch up with Dr Anne Webster, who's the Nationals member for Mallee down there near Mildura and that Sunraysia district of Victoria. Thanks for joining us, Anne. Last time we spoke to you, we talked about how there were COVID restrictions in Mildura. This is some months ago, and yet there'd never been any infections there for months. But you have had a case in Mildura and the whole area is locked down with the rest of the state. How are you bearing up, and has that case spread at all?
Thanks, Chris, for having me. Yeah, look, we've had 16 months of no COVID, but we've had the restrictions aligned with Melbourne as though we had the outbreaks. Now, this week, we do have 2 cases in Mildura, and I think it's brought home a little reality to the community. The town is like a ghost town, literally. Many businesses that might have stayed open as an essential service have closed. So the challenges for us are around supporting our businesses and supporting people to get those tests. We've had 2,000 tests thanks to Sunraysia Community Health, thanks to Bendigo Health who's come over here, and also Goulburn Valley. It's been all hands on deck. The gentleman who was found to have COVID on Sunday, I believe, went to the hospital inadvertently. So we now have 55 staff in quarantine. So it's a pretty challenging time, but honestly, the community is pulling together amazingly.
As they tend to do. Now, you're a medico. You are critical of our national approach at this stage. You think we should be rethinking it?
Yeah, look, I'm not a medico, my husband is. I'm a sociologist. I think that the conversation that we need to start having is around risk. I think that as governments, we're extremely risk averse. I mean, everybody knows you have risk mitigation plans if you're on a board or a school or an agency or a hospital, anywhere. We all are used to having risk mitigation plans. And I think that the lockdowns are heading towards zero at all times. And as you said earlier in the program, how long can we actually do that? At what point do we begin to open up? Because the risks for our economic future are really, before us.
Yeah, well said. We've really got to weigh those things up every day. Every day we continue down this path. No one's pretending it's easy, but we've got to balance the cure against the disease. Thanks so much for joining us, Anne. I appreciate it.
Thanks, Chris.
Dr Anne Webster there, who's the Nationals member for Mallee out there in northwestern Victoria.